Sağlık şakaya gelmez. Bünyesinde uzman doktorlarla hızlı ve güvenilir hizmet anlayışıyla uzun yıllardır hizmet veren Doctors kliniği, İngiltere sağlık sisteminde büyük bir boşluğu doldurarak toplumumuzun yanında olmaya devam ediyor. Ürolog Doktor Dimitar Ormanov, idrar yolu enfeksiyonu ile ilgili önemli bilgiler veriyor bizlere.
Hello everyone, pleasure to see you again. My name is Dr. Ormanov. I'm one of the doctors at Doctors for You Medical Clinic. I specialize in urology, and in our previous conversations we covered different urological topics. I would like to pay your attention on very serious medical urological problem which sometimes gets neglected by the patients. These are the urinary infections. So urinary infections is finding a bacteria in the urine. This depends of the patient gender, patient age, and also different conditions which might contribute to the urinary infections. It's more common in non-complicated urological infections, are more common in female population, and it's usually the bacteria which causes the problem is called Escherichia coli. The reason is that females have a shorter, different anatomy than a male. They have shorter urethra and it's easier for bacteria to get into bladder. It has been estimated that an adult sexually active woman has at least one infection lifetime. The symptoms of the infection might be pain in the lower abdomen, in the lower tummy, some unpleasant feeling when passing urine, discomfort. Sometimes you may notice blood in the urine and you may have pain and you may have unpleasant smell of the urine. This usually prompts treatment, which sometimes is neglected by the GPs, and the treatment is only just for a few days, 1 to 3 days, but sometimes this problem persists and needs to be more treatment in terms of antibiotics might need to be prescribed. This is a huge problem for most of the patients. Adequate and timely treatment need to be given and adjusted. If simple urinary infection gets untreated, this might persist, might get to more complicated infections such as a pyelonephritis, which is kidney infection, and this then might need hospital admission and a strong IV antibiotics treatment. The problem is different in the male population because the males have got longer urethra or water pipe, and for that reason they might not be that prone to urinary infections. However, every infection in male population needs to be observed closely because this means that there is an underlying problem. By underlying problem, I mean that the patient, especially if in older age, might be retaining urine and might not be able to empty its bladder, might have some bladder stones, and also males getting infection are at risk of developing distant infections such as a prostatitis or infection in the testis, which is more difficult to treat, requires stronger antibiotics, and like I said, might require hospital admission. So please, if you have signs of a urinary infection, you need to seek medical help and you need adequate treatment. I would like also to mention that sometimes, especially in patients who smoke, the signs of urinary infection might be early sign of urinary tract cancer, and therefore medical help is obligatory if you have, especially if you notice blood in the urine and pain during urination, and these symptoms persist for a bit longer. I would like also to cover a bit the sexually transmitted diseases, which happens usually when the patients are not taking the necessary precautions during sexual intercourse and sexual activity. This type of diseases are also part of the urinary infections, but they're more difficult to treat. And please, if you have any signs or any doubts that you might have achieved sexually transmitted condition, please come to us, see us, seek medical help. We can do the necessary tests and help you, because such type of infections are sometimes dangerous and might become chronic, might cause more problems for the future, different medical conditions. Last but not least, in male population, this might cause infertility. Thank you very much for your attention.